let's put the week into perspective, if we could. How much progress did we make this week as we learned tonight that U.S. cases top 100,000 and they've doubled in 3 days?
Well, look, we're making progress because we've implemented mitigation steps that are going to eventually stop the spread of this virus across the United States, including in New York City. New York City is going to top out, hopefully, within the next 2 weeks and start to come down its own epidemic curve. But there's a lot of hardship along the way before we get there. April's going to be a tough month. We will get through it. And coming out of April, we should be starting to come down the epidemic curve in the United States and see the other side of this. But other cities now, it's very clear, are going to heat up over the course of April, and they'll have their own epidemics. If you look at New Orleans, they have 1,200 cases there. Chicago's at 1,200. Detroit's at 1,000. Miami's at 650. Philadelphia's at 650. There's other cities behind that. But those cities that I just mentioned, those are a sufficient number of cases against a backdrop where we're not screening that much to suggest that they have pretty big outbreaks underway. They're going to be hard to contain, and they're going to have their own epidemics in those cities. And so what we thought might be just a single city epidemic like what China had with Wuhan, where they were able to contain it to a single epicenter, here it would have been New York, it's likely to be a sequential epidemic where it rolls across other cities, and so it's going to be a little bit longer.
We know things can change, obviously, very quickly with this virus. Can you tell our viewers tonight what you'll be looking for specifically over the weekend? Maybe they're unplugged from the TV as much as they've been lately. What will you specifically be looking for over the weekend to report on Monday?
The growth in cases in those other cities and cities behind them. If you start to see significant growth where you see doubling in the number of cases that are getting reported over time, over the weekend, over the next 3 or 4 days in those cities, that's a pretty negative indicator that you're going to have significant outbreaks in those cities and maybe epidemics. The other thing you want to look at is the positivity rate. How many people who are getting tested are positive? Right now in New York, it's very high. It's up to 50% in some parts of New York City. In other parts of the country, it's as high as 20%. If the positivity rate remains at those levels across the United States or in these centers where we know there's outbreaks, that's another suggestive signal that we're in for a little bit of a longer haul here, a little bit of a longer epidemic than what we thought. So whereas some of the more optimistic models put this peaking out in mid-April, it's probably going to last into late April, early May, which is what we've been talking about on this show, which I think is probably the base case right now.
I'm wondering, is it better at this point to put off the conversation of getting back to work if you're telling us this evening that you've got many more major cities than we've thought with an escalating number of cases?
Well, look, I think April is going to be a tough month. I think the conversation should be focused on how do we get resources into these cities to support the healthcare systems and try to preserve life. That's what we should be focused on right now. It's going to be a tough month. It was always going to be March and April, and April really is the hot month. April is the month that we need to get through. On the other side of that, we're going to come down the epidemic curve, and I do believe, I have confidence that we're going to have a therapeutic, perhaps as early as this summer, and a much broader screening program in place that we can identify outbreaks early and mitigate them and have drugs available to rescue people who get sick. So this is going to be a much different disease going forward, but we need to get through April. We need to get into the summer, and then we can look at the other side of this.
And it's good to hear because just to put this into perspective, the earlier indications from Dr. Fauci, from you yourself, were that it was going to take much longer, certainly for an antiviral drug to be out on the market. You're saying tonight we could have a therapeutic and even perhaps a drug by sometime this summer?
There's a study out in JAMA tonight showing that convalescent plasma, basically plasma derived from people who are sick and derived from people who were sick and recovered, and infused in people who were sick, is having a therapeutic benefit. And that comports with what we know about convalescent serum in this setting. It was used in H1N1 and also in the Spanish flu, with therapeutic benefits. And so it's a small study, only 5 patients, but it's a pretty dramatic result in the study. It supports the notion that monoclonal antibodies can also work in this setting. So drugs like what Regeneron's working on could be very promising. And they said they can have thousands, hundreds of thousands of doses available in the summer for the drug that they're working on. There's other companies working on similar approaches. Also, Gilead's drug remdesivir, we should be turning over the data card on that sometime this summer. And that might have an antiviral effect as well. And there's other drugs in development, other antivirals that are in development. We should be able to drug this target. This isn't a hard virus to drug. There's nothing really complex about how this virus replicates. And so I do think, given all the activity that's underway right now, this is really the focus of the entire pharmaceutical sector. I think we're going to have a therapeutic here very soon.